Hi, everybody.
Hello.
Well, welcome all of you to our second in the series of medical aesthetics. As I told you guys before, I have partnered with this wonderful friend of mine, Dr. Borosiak, who's a internal medicine trained MD, board certified, who practices internal medicine. But she is, as you can see, an extraordinarily fit woman. She's exercises, eats well, really got into wellness and health and fitness and shows and things like that. And she's developed this passion to not only do it herself, but make it a part of our practice and actually eventually, hopefully, just practice wellness care, medical health type of things. So she and I partnered together. She's been seeing patients at our Boca facility and hopefully soon in the Western facility as well. And she's doing weight loss management, medical hair loss management, hormone management, and other medical things that make people, well and healthy, not treat them when they're sick. That's the idea. So we did a first part of that series on weight management back a couple of months ago. So this is part two of that. And today we're going to talk about hair loss management. And this is a topic near and dear to me, and because I've suffered hair loss myself, and I suffered hair loss, during medical school residency time. I don't know if it was stress or just stress plus genetics, but I lost a lot of hair during that period of time in my life. And most recently, I did hair transplantation on myself and in my own office. And it worked really well. I mean, if I can show you the before and after pictures, I'll post them. But my hair was non-existent in the front, and now I have a fairly decent amount of hair. And during that time, Dr. Borosiak approached me and said that why don't we do medical management during your healing process? And so she ordered some products that are topical to apply on the skin during my healing phase. So I used it for about, I think, 8 weeks. I don't use it now anymore, but I trust that it has helped me retain more of those follicles. So I said, hey, Dr. Borosiak, why don't we just discuss this openly with the audience so they may also learn how medical management works, right?
Right.
So I'm going to go through these and we just have a conversation about it. So tell me a little bit about, how medical hair loss industry and, science really more like is evolving compared to 20 years ago.
So the main reason for someone to lose their hair basically is the age and reduced cell rejuvenation, reduced collagen production, as well as the hormones. The most common cause of the male pattern baldness is DHT, which is dihydrotestosterone, which is a byproduct of the testosterone.
Okay, let's hold on for a second. So let's just summarize it so the patients or the audience understands. So with aging and with genetics, and kind of predetermined way, people lose hair.
Correct.
And the reason they lose that hair, and one major reason, is due to hormones, right?
Correct.
And just so we are very specific, DHT is dihydrotestosterone, which is a very fancy scientific word we don't need to worry about, but it's a byproduct of testosterone that both men and women have.
Correct.
So is it normal or common for females to lose hair as well because of the same phenomenon?
Pretty much, yes. Not less in female, but more so in male. And what it does, it binds to a hair. DHT binds to a hair follicle, and they basically fall out. The hair follicles fall out.
But what? I mean, just for curiosity, that's like so bad, I mean, testosterone is very good for both males and females, right? For muscle health and vigor and all those other things. But it also has side effects, clearly.
Not the testosterone, but the DHT.
Yeah, that's one form of testosterone.
Correct.
So that's one reason. Are there any other reasons for hair loss?
Of course, nutrition, reduced collagen production, the vitamin deficiencies, excess weight. That has a really big effect on hair loss as well.
That's interesting. So general health also affects hair loss.
Big time, correct. Nutrition, hydration, stress is a big factor. Any hormone disbalances have
so
a huge
is
factor.
the reason for that generally because all these changes in our well-being change the hormonal balances in the body?
In the body, correct. So the hair, it's actively reproducing, actively growing part of our body, and at the moment it gets disbalanced or it doesn't have nutrients, it will fall off. And if your body does not have the ability to rejuvenate and reproduce it, that's when we see that.
Yeah. So tell me, you gave me some foam that I used, and I trusted you that that's going to work for me. Obviously, what was in the foam?
So the main two products that are available commercially, and which are minoxidil and finasteride. So minoxidil is the Rogaine that's available. You can buy it over the counter, pretty much. It's something that will stop the hair follicles from. It will increase the circulation to the hair follicles. So blood supply, so they will rejuvenate faster. Finasteride is, on the other hand, it will block the DHT from attaching to the hair follicles. So it will not stop you from producing your testosterone or other hormones, but it will stop from DHT binding to the hair follicles. So it will stop the hair loss process. So one of the foams that I gave you was in fact that. So it would stop finasteride. It contains the finasteride, which you can take in oral form for prevention of hair loss, or you can take it topically
so
as
it
well.
comes both topical form.
Correct.
Because a lot of people may not know that, because I think a lot of most people probably know about Rogaine because
Correct.
there's been so much advertisement about it. And are there different strengths of Rogaine that you feel works better for hair loss?
So there's two strengths. So you can I use a stronger one because but the reason why you use two strengths, because the stronger one may cause some itching and people may be uncomfortable, and it will prevent them from
So
using
you titrate it as needed.
Correct.
Yeah.
So if person, of course, the higher dose is much more effective, but if person develops itching and discomfort, then we go to a lower dose. It will still have some benefit.
Right. So we talked about so far two medications. Both are topical. I did not take any oral finasteride. I used the foam that contained the minoxidil, which is Rogaine.
Correct.
I used the finasteride, topical version, which is the
Correct.
application version. But it also had something called a copper peptide. Can you tell us a bit about that?
Right. So it's a naturally occurring peptide that we all have, but the level of the copper peptide gets decreased with age. What is really, really important when we apply it topically or when it's present in the body, it induces the enzymatic exchange, and it produces actually hair growth and tightens the collagen. It's actually very well researched peptide nowadays. It's a low price.
What is a peptide actually?
It's a simple protein sequence. It's like a messenger that tells your body to produce certain proteins.
So it's actually not the protein like we feel protein to build muscles, but it's a different type of protein.
It's basically a messenger that tells your body to produce and regenerate certain function, and like insulin is a peptide. So it's a small protein sequences that acts as a messenger to produce certain effect in the body. So
again, just to clarify, because there's a lot of confusion people have, because it's deep knowledge in this is necessary to fully understand it. But when we eat protein like meat or protein shakes and stuff, that's very different.
That's completely different.
This is a different type of protein form that essentially functions as a signal for the body to do something. It's not a protein that's going to build muscles and things like that. So they have different functions for different proteins.
Correct.
So that also was in a topical form
That was in a topical form. So like I said, it does help to regenerate skin. So it tightens the collagen. The copper peptide can be used for the hair, can be used for the skin creams as well.
So now it's being formulated as a topical agent for a lot of things.
Correct.
Right. So I also heard a little bit about its utility in wound healing, right?
Absolutely. It's mainly because of the regeneration and collagen production.
So I also noticed on the label that there's retin-A in it.
So retin-A in the same time, right? So there was a small proportion of the retin-A that helps. The retin-A helps to exchange the cells. So it gets rid of the old cells and helps to promote the new cell growth. So it kind of cleanses. It's basically a peel.
Okay, so to go back again, we are kind of putting the kitchen sink together.
Correct.
Right, for the hair. So we have retin-A, we have copper peptide.
Correct.
We have the finasteride.
Correct.
And we have the minoxidil so far.
And
but that's not all.
Caffeine.
Caffeine. Tell me about
So
caffeine.
the caffeine is a stimulant, so it will also improve the circulation and widen the vessels. So it's mostly for the exchange and the stimulation of the hair growth.
So I mean, this is interesting again, because I love to probe deep in some areas. So, like, a young person in their 20s, let's just say, also can lose hair. A
Right.
person in 30s or 50s can lose hair. So, is the assumption, baseline assumption then, that somehow their circulation is bad, that you have to improve it further? Because I would imagine a young person would have a good circulation.
A lot of times people have inflammation in the hair follicles, and they could be for many reasons. Some skins are too oily, people who suffer from acne. So if you have a chronic inflammation on the follicles, that's really will actually stimulate, not stimulate, it will actually cause hair loss and slower healing and slower rejuvenation of the hair.
So inflammation triggers another question, is that I also noticed that a fungal medication called ketoconazole is
Correct.
also used for this. How does that work?
So it actually stimulates the hair growth in its active phase. It's not just antifungal, but it also will reduce that hair follicle inflammation, and it will reduce the binding of DHT to a hair follicle. So it has many other reasons that you could use it.
So
and
so
benefits.
so when I tell my friend and say, hey, I'm taking this antifungal cream for my head, I won't look crazy and say,
No.
you have a fungal infection, don't touch me, kind of thing. It's for a different reason.
If for different reasons.
So
correct.
even though I don't have any fungal problems, it still helps with the hair loss
with
portion.
the inflammation and correct.
Is that in the foam as well, or is that a medication or another?
It's in the foam, and it's actually available. Just the ketoconazole you can have in the dandruff shampoos.
Oh, so you can either, okay, gotcha. So, but is there also an oral form of it, or you don't need that?
No.
So just either shampoo or in the foam itself.
Correct.
Okay, and there's also blood pressure medication. I heard spironolactone, which I've heard is used for some bad hair growth, like some patients that I take care of who have bad hair, ingrown hairs in their armpit or somewhere else. I think are medically treated with spironolactone, which is truly a blood pressure medication. How people know about it. How does that work?
But it's also bind to the hair. It reduces the harmful hormones, which in this particular case is DHT. Again, we're going back to DHT because byproduct of excessive testosterone will be DHT, and it will reduce those hormone levels, and it will help again as well with inflammation. Through the enzymatic reduction.
So is this foam something that because right now patients only have Rogaine available, right? Over the counter. So is this something that they can get somewhere, or do you prescribe it, or do you order it? Where do they get it?
For now, it's a prescription only because it has to be. I usually try to tailor it based on the patient as well. Patient needs what they need. And also the shelf life, it's a fragile peptide, has to be refrigerated, so it has to be specially compounded particularly to a person, and it has to be kept refrigerated.
Okay, so just to be clear again, of all of the compounds in the foam, the peptide, the copper peptide, is the most fragile.
Correct.
And hence, because it's in the foam, it has to be refrigerated.
Correct.
Right. So if a lot of young folks are not that diligent with what they do, I mean, a lot of times they don't even put cream on. I don't know if they're going to put it in the fridge and use it.
And it's crucial though, the diligence and the consistency with use of the peptides and the foam is very important.
Do you use it once a day, twice a day?
Ideally twice a day for the course of treatment. And
do you do it forever or just around the treatment?
Yeah, I would do it around the treatment, and because again, you can do a course, like 2-3 months course, and see whether up to 6 months you can see really good response. After that, you don't really see it. And in the same time, we work with the patients around internal health and maximize and optimize the nutrition in order to have that. And also oral foam is available for the finasteride for men and women. I usually don't use it. I try not to use it, let's say that way, the oral form. It's only because those hormones, again, they're actually good for you as well. So we have to kind of balance it out.
So do you generally test for testosterone on patients?
I would test for all of it. I would test for testosterone. I mean, not for the particular hair restoration. No, you don't really need to test it. but for the overall well-being and wellness and evaluation for hormone optimization, anti-aging purposes, and if you want to really maximally benefit, yes, you do want to test testosterone, estrogen, DHEA, all those things, so you will have some idea what's happening to your in your body and what would you benefit the most, again, from the topical form or actually oral form.
Correct. So this is a lot of great information. Many of you may not know, but at Surya Cosmetic Surgery and Med Spa, that's the name change, and we're going to go to Weston. I'm so happy to have Dr. Borisiak as a partner because we do offer hair restoration surgery. I just did it in my own office. Like I said, I'm a big believer. I'm an advocate for it because it's made a big difference to me, how I feel about my hair. And since I've used it and my hair is coming in well, a lot of people are commenting on it. I do believe that it works. So we welcome all of you for hair restoration. Now that we have a partnership here, not only do we do surgical hair restoration with neograft techniques, which is follicular unit extraction and transplantation, which is the latest way to do it, the best way to do it. We also now do a comprehensive management with the medical hair loss treatment as well as a proactive preventative measure to get the best outcome. One last thing that I'd like to ask you before we finish. Do you have enough information about lasers for the hair yet, or is that something that you don't do because it's more?
I don't really have that much of information. I know there are products out there, the hats with
laser cap,
infrared or everything.
Yeah.
And I've had some of my friends use it. I haven't seen much of response, but again, I believe it has to be part of the whole treatment. You can't just use one treatment because only single treatment just with the laser will not do.
So another interesting thing that I think maybe this requires a part 2, because I do want to talk a little bit more about the more involved or invasive. I don't want to call it invasive because it's truly not, but there is some early reporting. I wouldn't say data or anything, where maybe doing some microneedling to the head.
Correct. Yeah, there are data, right.
Things like that, because again the idea is rejuvenation, recycling, kind of regrowing the the healing phase of just like the phase, even in the scalp, it may help. So maybe we'll do that at another time, but I think this is going to focus mostly on medical management. So I hope that was very, very helpful information for you guys. If you have any interest in hair restoration, please come see us. If you have interest in medical hair management, please come see us. We can manage comprehensively everything about wellness and aesthetics. Thank you. Have a great day.
Have a good day.